Welcome back. Matthew McKenzie here, care activist. Also raise awareness on mental health, mental well-being, unpaid carers, obviously. But this time I'm raising awareness on the new initiative, or I say fairly new because it's been around for a couple of years now. The new NHS England's framework, which is the Patient Care Race Equality Framework, aimed at reducing racial discrimination at mental health trusts. The point of this particular lecture is aimed at those involved in helping to shape services on an involvement level at their local mental health trust. Not saying that's easy to do because one might not have the time, and it's not strictly aimed at minority carers or patients. It's aimed at anyone, to be fair, who has a passion and wants to be involved in making their organization anti-racist, anti-discriminatory, and improve health equity for all groups of people, especially those who get a bad deal. I'm talking about minority groups who get a bad deal from mental health services. But the big question here is, how do you know when mental health and trusts are failing on this framework? Not something that's going to be particularly easy to understand if your mental health trust isn't that transparent. But what I will do is throw a bit of ideas for yourselves if you're involved in your local mental health trust, or even if you feel it's a struggle to get involved in your local mental health trust regarding this framework and others, to be honest. So what we're going to do is we're going to go looking at the following points of what I'm going to try and cover in this lecture. I'm going to try and keep it short. I don't want to waffle on, which I tend to do. But I wanted to do this particular lecture because it is quite important, and because of the groups that I run, I want to try and leave a bit of education behind. And you have to excuse me on this lecture being fairly brief because there's a whole lot more to it than what I'm presenting. But I do promise to revisit not just PCREF, but when it comes to minority groups and mental health overall. It's a very complex and difficult topic. So, okay, what do I cover? And apologies again. I'm actually looking at this from let's say a carer PCREF lead. It doesn't have to be if you're like looking at this from as if you're involved in your mental health trust and you're like a patient. When I'm saying involved, I'm not talking about being involved in receiving services or being included in services. I'm talking about being involved in shaping services and being included to shape those services. So, okay, how do we know when mental health trusts are failing on PCREF and you're a patient or a carer and you want to influence and be part of an activist sort of method when it comes to PCREF? And the reason, obviously, and this is the last thing I'm going to mention, the reason that is so important is you do not want to wait until the CQC, even though it's not your fault really if you're not supported in your role. But what you don't want is you're going to wait for the CQC to turn up at the mental health trust door, who will grade your mental health trust on PCREF. And if they fail, it just looks bad, if you know what I mean. It might not be your fault anyway. So one thing I want to cover before I even reach this bit, I'm going to at least mention just a minute or two about PCREF. But one thing that can fail on is the persistent racial disparities in when it comes to service access and outcomes. Lack of cultural competency in care delivery. This stuff will cover briefly though. Inadequate representation of minority carers and patients in decision making. Failure to address and prevent discrimination and stigma. Lack of clear and effective PCREF integration into policy and practice. Inadequate monitoring and reporting when it comes to race equality. And there's a lot more than just that, to be honest, but I'm making it fairly brief. One of the main things you need to try and look out for, obviously, you will need to be supported in doing that, to be honest. Insufficient support for minority carers, and do excuse me, I'm a little bit blinded, I suppose. I've got a blinkered approach. I'm coming from it from what I tend to know regarding families, friends, and unpaid carers, but you can just change it and say insufficient support for patients if you're looking at this from that type of view. Lack of community engagement and collaboration. Obviously, I've got to put in minority engagement, but that's not the end all and be all. I do think it's important to engage the community as a whole as well regarding what the mental health trust is trying to do. Patient and care feedback is ignored and undervalued. That's a whole lecture in itself, to be honest. And in fact, many of these points are, but I'm just sort of trying to group one of the core all lot together. And I'm sure there's a lot more, but these are the ones that I've picked up on. And lack of support for when it comes to social reintegration of service users or ethnic minority patients. So let's first look at, what on earth is Matthew on about? What is this PCREF stuff? Well, as I mentioned before, the Patient Care Race Equality Framework is a strategic approach launched by NHS England aimed at addressing, I'll put this in bold, racial inequalities in mental health care. Ensuring that, minority patients and carers receive equitable, culturally competent support. It focuses on improving access, engagement, and outcomes by integrating cultural awareness, empowering patients and their loved ones, whether that be families, and promoting inclusive practices within mental health services. So that's in a nutshell what PCREF is. Like, it's more to it than that, but that's got to keep this lecture short. So that's in a nutshell what PCREF is. But let's start on the first thing. When it comes to you noticing perhaps that your mental health trust is failing on this. So, as mentioned, persistent racial disparities in service access and outcomes. You might see from this picture, why has Matthew got these sort of funny looking graphs and bar charts and graphs shown here? Why? What's this all mean? It's data. That's the be all and end all when it comes to working out what your organization, your mental health trust is doing. So if data is showing unequal access to services for patients from minority backgrounds, they're not getting access, or they're getting bog standard service support and the data is showing it. This is something you can try and point out. It's not easy to do because one of the big problems when it comes to involvement in these things is how well trained or empowered patients and carers are when it comes to these things. And even if they were showing data, is that data easy to understand, or are they having their rug pulled underneath them? So it's not easy. And the problem with data is it can say a lot in strange ways, and you're still not sure what it means. But if you're lucky enough, suppose, and data does show this, then this is something, especially if you're PCREF care lead or patient PCREF lead, something you can point out. So, at the end of the day, it's about the data. There's another thing that when it comes to failing on PCREF, if the data does show, reports show higher rates of detention under the Mental Health Act, which is again being revamped as I'm speaking. The one that is old is the 1983 Mental Health Act. As I'm speaking, the first reading was actually the second reading, I believe, is actually tomorrow at the House of Lords. But yes, if the high rates of detention under the Mental Health Act or longer waiting times for ethnic minority patients compared to your local population, and data is showing this, then this is a way of sort of saying your mental health trust is failing when it comes to persistent racial disparities in service access and outcomes. There's a lot more to this, but this is something I feel is kind of core when it comes to these things. So that's number one. I've also forgotten ethnic minority patients may experience poorer mental. I think this is not that easy to actually point out really. But if they experience poor health outcomes or lower recovery rates than their counterparts, again, you would look for you ask for reports and data when it comes to those things. Not easy to do, to be honest. So, yep, going on to the next one, a lack of cultural competency in care delivery. So here we have mental health services do not show sensitivity or awareness of cultural needs of ethnic minority patients or service users, including language barriers, um, religious practices, or culture appropriate care options. So basically, I'm not going to spend too much time on what you need to look for, because again, that's a whole other lecture. I'm going to just point out, what the problems are, that's the first step. That's a red flag. And then from there, you can say, well, why is this happening? That's the most common question you'll be asking them. Usually this will come from feedback, reports, surveys. That's something you need to push for if you're involved at this type of level. Or if you're not sure, you ask them. You just ask them, how are you measuring those using the services when it comes to language or it comes to religious practices? How are you measuring? And then when you get that answer, and if there's something coming out of that, then you just say, look, okay, we need an engagement event or a meeting to measure this. There's more to it than that, obviously. The other thing is care plans fail to incorporate cultural preferences and are not tailored to meet individual needs of ethnic minority patients. Again, something, and saying this is not your role really to look at care plans. Don't be fooled into that. This is mental health staff. That's their role. What you're interested in is you'll be asking the questions. How does those care plans, you know, meet cultural preferences, and again, how is it measured? How does it fit into the data? Because if you're involved at this level, that's what you're sort of looking for. Again, one of the core aims. So that's number two. Lack of cultural competency in care delivery, and there's not more to it. Obviously, there is, but these are the things I've decided to mention. Number three. I don't know if you can spot a difference here when it comes to those pictures. It's quite easy, really, when it comes to this question: inadequate representation of ethnic minority carers and patients in decision making. And I can't give you a reward or a point or anything, but the picture on the right is something you want to be looking for. The other two pictures, not so. Carers from ethnic minority groups are underrepresented or excluded from care planning and decision-making processes. So don't get me wrong, there's two ways of involvement. One I mentioned is in receipt of services. So this is basically what this is looking at, but also in the other involvement area where you're helping shape services. So there's two things when it comes to this one. But I think most of all, though, most of what I think is really important is if you're trying to support someone who is using those services from a minority background, how are they included when it comes to care planning and the decision-making process? Because at the end of the day, what PCREF is interested in is the outcomes for those using mental health services. And if they find that there's underrepresentation or they're excluded from care planning and that patient health deteriorates because of those things, then that means your organization is failing when it comes to care for minority groups. Ethnic minority patients and carers are not actively engaged in care planning meetings or service evaluations, and the voices are not heard or not even seen in the decision-making process. So this is something, again, if you're involved at this level, something you would at least ask, how are we measuring for those things? And if they are, what is the comparison between most recent forms of reports or data compared to 2 months back, 4 months back, to see what what the improvements are. It's not your job to measure them though. Mental health trusts have a whole department for these types of things. That's number three. Number four is failure to address and prevent discrimination and stigma. Very difficult though. I don't think this one's easy. Because these things are not easily seen, and even if it happens, how well are not just patients and carers, but staff, how well is it easy for them to report it? So but we're looking at patient and care. So minority patients and carers report feeling discriminated against, marginalized or stigmatized by healthcare providers. That's if, and the key word there, I should have put it in bold, report. They're reporting it. You as a patient lead in PCREF or carer lead might start asking for the numbers of reports and even hints at, what's the keywords, what's being mentioned, what is being mentioned here. Is it discrimination? Is it stigma? Why is this happening? And I was going to also mention, if I go back a bit, again, this is a whole nother lecture, to be fair, because even if this is happening, what is it that you're actually looking for? What is represented as stigmatized? What is represented as discriminated against? So this is something, again, I think it's very tricky. It's in another lecture, but again, if these things are happening, then they're failing. Staff members are not trained in anti-racism. This is the actual answer, to be fair, when it comes to those things and a lot of other things as well. But staff members are not trained in anti-racism or cultural competence, and discriminatory behaviors are not being addressed or reported. So that shows that, again, they're failing. If staff members are continuing to practice discriminatory behaviors, bias, that type of thing. Number five, you can see the picture here. It looks like a big bunch of papers, but what do I mean by that? I mean policy and actually practice. So there's a lack of clear, effective PCREF integration. And I'm sorry, again, integration, no time to look at that today. But something you want to be looking out for. How often is PCREF mentioned in those things in policy? So PCREF principles are not actually embedded in organizations' policies, procedures, or everyday practices. There's a lack of clear leadership on PCREF initiatives and accountability for racial equality, which is not maintained. Who is the lead on this? Do they mention it often? Cultural competency training, and this one's probably the most important of all, to be honest, is sporadic or non-existent, with no ongoing professional development to ensure all staff are equipped to work with diverse patient populations. The good news actually on this is I do actually have, I've come across 30 different training modules, and thanks to the NHS trusts that have, provided some in advance. I'll go through at least one or two. They're heavy stuff, but very good. And I've usually been getting them from the groups that I run. But yes, cultural competency training, loads of the stuff, including the bias. But what I'll do, to be fair, I'm not going to mention it now because I'm getting a bit sidetracked. I'll mention it at another lecture. There are loads, and they're all very good when it comes to PCREF. So the next one, inadequate monitoring and reporting on racial equality. So, there's no regular reporting or monitoring on racial inequalities in mental health care or services. Data on ethnic background of patients, the services they use, and the outcomes are not systematically collected, analyzed, or used to inform practice and policy. So if you're involved, and this sort of thing isn't mentioned, the types of reports, the data, what's collected, what's analyzed to inform of that practice, then it's a big sort of hint, it's a clue that something's not quite right, something's failing here. We'll go on, and again, excuse me being a bit blinkered here. Insufficient support for minority carers. So carers from ethnic minority communities are not provided with, again, it's looking at training for them with culturally appropriate support resources or training. So this is more of the chicken or the egg sort of issue. How can the patient and the family know what to look out for when it comes to, and I'm sure quite a few do it, to be honest, when it comes to discrimination or stigmatization. But some of these things are subtle. Some of these things are complex and also very clever. You can't often tell. So how are they trained? How are they supported? What do they need to look out for? Do they know they're receiving, you know, not the best type of service? There's also a little recognition of the unique challenges that ethnic minority carers face, such as, again, and do swap it if it's patient, but such as language barriers, cultural differences, socioeconomic factors affecting their ability to support those that are using those services or that are in their care. We'll continue on. Lack of community engagement and collaboration. Not an easy one, this, to be fair. Several reasons. It's a whole nother lecture though. But several reasons getting that interest, getting that engagement from, those who may use your services. I don't think this is quite easy, this one. But if there is insufficient collaboration with community organization or local groups that represent ethnic minority communities, then this is going to lead to a disconnect between services and cultural needs of the local population at hand. So this is very important. That's why I mentioned it. It's got to be that engagement. It's got to be that collaboration, but there's also got to be the interest as well. And there is issues that community groups out there might even know PCREF, but might not be that bothered, or might sort of say, "Oh, well, here we go again." Another initiative that's going to fail. That's probably what you might encounter. It doesn't mean though you can't, you shouldn't try, or your organization shouldn't try and engage and collaborate. Also got services do not make an effort to engage with um, ethnic minority groups in the development of these care programs or service evaluations. So not too long to go. So the next one is patient and care feedback is ignored or undervalued. So feedback from minority patients and carers is not actively sought, valued, or acted upon. We also have concerns raised, and this is quite important, this one, because now they're raising it. So concerns raised by minority carers to patients about discrimination, cultural insensitivity, or even service gaps not addressed, or feedback is not taken seriously by management. So again, if point number 9, patient and care feedback is not valued or ignored, then you've got a time limit really when the CQC come knocking, looking for these things. I think this is the last one. I've got a little flow chart here. But what do I mean by this flow chart? Lack of support for social reintegration of minority patients. So they don't know where they're going in the community. So there's a lack of community engagement based interventions that support the social reintegration of ethnic minority patients. Post-treatment, talking about post-treatment, and then coming out from the inpatient ward. Or being referred back to the GP, to be honest. Tricky if it's back to the GP. But anyway, while they're with the organization, obviously getting in receipt of services, then such as cultural adaptation or rehabilitation programs or ongoing support for minority patients transitioning out of institutional care. So that needs to be there. So I put that flow chart, how and where do they know where the guy is that service and support culturally appropriate. And to be honest, even before pre-COVID, this was complex in the first place. Mental health, I still think mental health systems are very complex. And if you're unwell, it's going to be even more difficult. But obviously, if you're coming from a minority background, then it's a triple challenge because it's not designed with you in mind. But now's the chance with PCREF, it possibly can be. I'm not going to say it's going to be easy, though. Services fail to incorporate social support networks that are culturally appropriate and accessible for minority groups, hindering recovery and integration. So Summarizing this up, an involved PCREF care lead or patient or even group um, involvement group, depends how the framework is set up at your local NHS trust, would need to recognize, the failing implementation of that framework. Some of the points I've mentioned here, there are more. There's a whole lot more, but I think I'll just put the core lot that I've come across. If the mental health trust shows systematic neglect in addressing racial inequalities, lacks cultural competence, excludes minority carers and patients from decision making, and fails to integrate PCREF principles into daily practices and policies. Well, I'd like to say thanks for watching. It's not been an easy lecture. I do hope, it makes you think at least that. I mean, holding to account is a whole different ball game, to be honest. And I don't think it's ever going to be easy. Don't sort of listen to someone to say, "Oh, it should be." It's not. But I'm just sort of leaving my thoughts and ideas, that could help guide those who are trying to be involved, really, or who are involved, and feel they're not supported as much as they should in trying to hold to account and what to look out for. But I do promise to revisit, if it's not PCREF, then other things regarding disparities, bias, health inequalities. I'll always revisit when I can. I'd like to say thanks for watching. If you like this video, give it a like, or if you want, subscribe. I'll always try and raise awareness, even though I tend to focus on unpaid carers most of the time. See you next time, and thanks again for watching, and look after yourselves.